Hey, y'all. It's 2 o'clock on a Sunday afternoon, and I have some feedback or updates for y'all. So, just in the vein of being more specific, I'm sure you've heard me mention in my previous videos that I use an app called ShiftKey to pick up shifts, right? Well, you can never be too reliant on one method of like gig work when it comes to nursing. So a lot of nurses you'll find that do things like Shift app have something else called Clipboard or IntelliCare or eShift or Connect RN. Those apps give you flexibility, and they give you more options when it comes to pay, different facilities, and different areas and things of that sort. So I ventured out and I said, you know what, let me see what they have on Clipboard Health. Because the funny thing is, and this is not me going back to the whole topic of Georgia being so horrible, but it is. But in Georgia, there were absolutely no clipboard shifts to choose from, none whatsoever in my area. And whatever they did have to choose from weren't shifts that I would want to pick up. But I don't even recall them ever having one shift. Okay, so anyway, I picked up my first shift with Clipboard Health. I'm not going to mention the facility, but it's very popular here in the DMV area. And of course, with how pleasant my experience has been with ShiftKey, I expected nothing less from Clipboard Health. Boy, was I wrong. Clipboard Health is so stingy that they don't allow you to clock in before your shift. So let's say it's your first shift ever, and you need to get your credentials, you need to know the facility, you need to know, there's certain things that you need to have, like a mini orientation before you start picking shifts at a specific facility. Y'all, I was there at 2:26. When I opened the app to try to clock in, they said I can't clock in until 3. I was like, well, then I won't be going in until 3. I'm not going to just go in and sit around and then be held liable if something goes wrong, So I waited until maybe 2:52, and then I walked in. You have to screen yourself when you walk in for COVID, and then sign in and get the little sticker that says you're a visitor or whatever, or you're from an agency. So I did all that, and then I get to the supervisor's office or the staffing office, around 3. Everybody's outside the office waiting to sign in or get their assignment or whatever. And it was in that moment that I realized that, definitely, obviously, all facilities are not created equal, but not all apps are created equal. And this particular, I guess, long-term care facility brand, I'll just leave it at that, I don't know if they have necessarily a great, reputation. I haven't worked here enough to get, feedback from different nurses, but from what I had, from the experience I had yesterday, they're disorganized. So I walk in and I'm like, oh, I'm here from Clipboard Health. I'm here to work a 3 to 11 shift. And, I would like to know my assignment and get my credentials. She said, oh, you're on 2 North. So I go to, the unit, and then there's 2, I guess, nurses sitting at the desk. So I introduced myself. We had a little chit chat. I like to be very social and very personable and establish rapport immediately, because when you're an agency or a travel nurse or anyone who's not a permanent staff, you're at the mercy of these people, and you need them to like you immediately. You need them to be on your side, not in a people-pleasing type of way, but I'm a professional, I'm here to help you, and just help me help you so that we can both go our separate ways, happy and paid, right? Oh my God. So after I got there and I told them I still don't have my credentials, is there any way I can get it so that I could just see if my login works before I get report? I was tossed back and forth like a basketball. I had to walk down back to the supervisor's office, who thought I was a GNA. So she told them that I was a GNA. And I'm like, you saw my badge. I'm not wearing my badge right now, but I wear it all the time. And it says in big letters, RN. So why would you say I'm a GNA? And just to, this is why sometimes as Muslim nurses, who physically cover, who are visibly Muslim, sometimes your brain can help to think do people associate, covered women with being less educated? This is just a question. I'm not saying that that's what it is. Like, in my opinion, there are a lot of Muslim women, especially the ones that are covered, are like physicians, or they go for higher learning, they go for PhDs. They're doing something, whether it's business, education. So what is this ignorant notion that you just size someone up and then you ask them and you see their badge and you still say that they're like not what they're there for? That didn't make any sense to me, and I was actually quite offended by that. I'm also in my luteal phase, so that like says a lot. But so I went back to the office and she goes, oh, okay, just go back and tell so-and-so that. And I said, I'm not a messenger. If there's anything that you need to communicate, please pick up the phone and call, because I'm here to work a shift, not to relay messages to anybody. Y'all, I went back on the floor and then I asked again. I was like, I still don't have my login. They said to go back to the office. I went back to the office and she said, well, you have to wait until 3:45 because if we call now, they're going to have you wait anyway. I'm like, wouldn't it make sense, right? Wouldn't it make absolute sense for you to have my credentials ready before I get to the facility, so that your nurse that's been working tirelessly since 6 or 7 a.m. could leave, if she's done with her work, and that I can start, because I don't know these people, I can do my rounds and have enough time to prep medications and prioritize who gets seen first and so on and so forth. Y'all, I waited. I didn't get my credentials to log into the system until 4:06 p.m. And you know how dinner time comes like around 5, most facilities, between 4:30 and 5. So the computer will have you start checking finger sticks at 4:30. I didn't start checking my finger sticks until 5. And mind you, I had 20 patients. So I was way behind. And oh my God, the shift was not good. The shift was not good. The 2 LPNs that were there were rude, nasty, mean, disgusting. And I told them, like, I did not mince my words. I told her, you guys are, all of y'all are rude and nasty, because prior to me getting into the computer that's actually on the cart, the medicine cart that you push around to give medications, I had already logged in on the front computer and it worked. But when I got to the laptop, I guess the login, page, like the home page, was different. So there was some buttons I wasn't able to navigate to because I didn't know which icons to click. So I simply asked the nurse who gave me a report to just come down to the hallway, because I had moved the cart from where it was, to just show me how to do it. She asked me to push the cart all the way back down. I said, what? I said, I'm not doing that. So I went in to go get my phone to see if there's anyone that could like help me with this, because I need to get in on the medicine cart. I can't run back and forth down the hall, and these halls are long, y'all. These halls are super long. I can't run back and forth, to the front computer to give meds. That would be asinine. Like, I wasn't even thinking of doing that. So I was in the med room when one of the LPNs came in. I didn't even know she was an LPN at the time. She came in and I was expressing my frustrations to her, and she gonna tell me to calm down. I said, you know damn well that when somebody is frustrated, you don't tell them to calm down. You find other ways to rectify the situation and then later have a conversation about it. What I'm upset with is that this is a patient safety issue at this point, because not only am I not able to log in and give medications on time, but I also have like finger sticks, So she finally agreed to come all the way down there and help, because it seemed like she was a bird brain herself, because she didn't know what she was doing. When she clicked on the icon that I needed to click on, I picked it up from there. And I was like, thank you. And she was just like, later on in the shift, I think I had called the supervisor for something, and I was expressing. I told him, I'm not Sonic the Hedgehog. If the family cannot wait for a PRN medication, I'm giving somebody medications that like can't really swallow very well. And then, unfortunately, just to cut the story short, she ended up vomiting later because this family was too impatient to wait for me to bring a PRN Tylenol. Mind you, this patient that they're advocating for had already gotten OxyContin like less than 2 hours ago. And she's also sleeping. She's a G2 patient. She's resting calmly in bed. But the family members that want to show that, they're involved and they want to make you work while they're there. And I told them point blank, like, I'm in the middle of doing something else, and you're sending the second family member to me, and it's not considerate, because I've already said I was going to come back, and it's been less than 5 minutes. And then, I called the supervisor. If you want to hear the rest of this story, stay tuned for part 2 and let me know in the comments.